Sitting, operating theatre, recovery room. You are a nurse in an operating theatre recovery room. A 40-year-old Alice is recovering after the hip replacement surgery. She seems a little confused about where she is. She keeps asking about her daughter and to have a glass of water or cup of tea. Now let's see the task. First one says, explain her current situation. Then, check if she understands everything. Third one says, re-explain if necessary. Then, tell her that her daughter is waiting for her in the post-operative ward. Fifth one says, explain that hospital policy excludes visitors from the recovery room. Sixth one says, explain why she cannot have fluids by mouth at this stage. The last one says, assure her that she'll be taken back to her ward shortly and then her needs will be attended based on the doctor's advice. Now, let's begin the role play. You can start like, hi, good morning, Miss Alice. How are you doing now? Then interlocutor may respond you saying, I'm really tired and exhausted. May I know what's happening here? Then responder saying, please relax, Miss Alice. I'm John, the registered nurse working in this operating theatre recovery room, and you're currently in the recovery room after the successful hip replacement surgery. But don't be overly concerned. You're recovering well after the surgery. We all are here to take care of you. Please let me know if you have any concerns. Then interlocutor may respond saying, nurse, I'm not able to remember anything properly. I don't see my daughter here. Where is she? Then responder saying, being a mother, I can completely understand your worries, Miss Alice. But don't be worried too much. Your confusion and drowsiness are simply due to anesthesia. As I already mentioned, you're in the recovery room after the hip replacement surgery and your daughter is waiting for you in the post-operative ward. Therefore, I can assure you that you can meet your daughter once you are shifted to the post-operative ward. I hope you're following me, Miss Alice. Then interlocutor may respond saying, I understand that, nurse. Can you please ask her to come inside the room? As you know that, I have not seen her since yesterday. Then responder saying, I'm really sorry to inform you, Miss Alice. We cannot allow your daughter to come inside the recovery room. As I told you already, you can certainly meet your daughter once you are shifted to the post-operative ward. So kindly understand the situation. Then interlocutor may ask you, nurse, I don't think I'll be able to wait until then. See, she's my only daughter, so I request you to bring her inside the recovery room so that I can have a word with her. Then responder saying, I completely understand your worries, Miss Alice. Please be aware that visitors are strictly not allowed inside the recovery room. Apart from that, our hospital policy does not allow any visitors inside the recovery room. As you know that, this recovery room is highly sterile area, so we cannot enter any visitors inside the room, as it can cause some kinds of infection to the other patients who are already there. I hope you understand the situation. Therefore, I can assure you that you will be shifted to the post-operative ward shortly and you can meet your daughter over there. Okay, Miss Alice, I hope you're following me. Then interlocutor may respond saying, okay, nurse, I understand what you're saying now. However, as I told you initially, I'm really exhausted. Can I have a cup of tea or coffee or at least a glass of water? I'm feeling really thirsty. Then responder saying, your concerns are completely understandable, Miss Alice. Unfortunately, you are not allowed to take any kinds of liquids orally at this moment due to the fact that you are not completely awake from anesthesia. So after the surgery, your intestine can shut down for some time. So your digestive system needs some time to come back to the normal level. If you take anything orally now, it may cause nausea, aspiration, and it can also lead to vomiting and other complications. That's why you've been provided with intravenous fluids after the surgery. That will certainly keep you hydrated. So I can reassure you that you're completely safe in our hands. So nothing to be worried. Then interlocutor may ask you, right, nurse, how long should I be here to see my daughter or to get something to drink? Then responder saying, your question is really reasonable, Miss Alice. It may take approximately 2 hours to shift you to the post-operative ward. But don't be overly concerned. Our doctors are going to visit you shortly to evaluate your improvements. So I can assure you that you'll be shifted back to the post-operative ward as soon as your health is satisfactory. So kindly understand the situation and cooperate with us. Then interlocutor may agree with that. Then continue by saying, I'm really glad that you have accepted my suggestions. Okay, Miss Alice, do you have any more questions for me? Then interlocutor may tell you like, no, nurse, nothing. Then we can wind up the role play by saying, I hope I have clarified all your concerns and queries. If you have any more questions or concerns, you can press the buzzer which is near to your bedside. So I will be here to help you. So once again, I assure you that you will definitely be shifted to the post-operative ward shortly, and you can meet your daughter over there. Along with that, your needs will also be attended as per the doctor's advice. So thank you, Miss Alice, for understanding the situation and listening to me patiently. I wish you a faster recovery. Thank you, guys. Our role play ends here.